Well, guess what time it is? It is time for Q&A with Dr. Frank Barone. We are talking about all things skincare, and we said that we kind of have a theme today, right? We're talking about wedding season. It is not here yet, but it'll be here before we know it. So
that's true. That's true.
It's time to prepare.
Okay.
Right?
All right. So you're not talking about wedding dresses or cakes or catering, but
no, just the skin.
Yes. So I'm assuming you get all kinds of inquiries, and the first one, what are the latest advances in liposuction that some brides might want to go under before they get married?
Well, liposuction has changed a lot. It's much safer now, and new techniques allow you to remove the excess fat very safely and do it more comfortably with less downtime by using ultrasound and different types of fluid to wet the tissues so that you recover quickly and don't bruise as much.
Okay, now the one thing, I mean, maybe that's a little bit of a stretch, right? Liposuction before a wedding.
Well, wait, I don't want to get buried on this. Some grooms and groomsmen too, not just brides. I know somebody's gonna be like, you said.
I'm like, I don't know, I don't like where this is going.
I'm sorry.
But, you know, the one thing that we have to talk about though is if you are seriously considering something like that, what are the first steps that you should take? It's not like you just come in and it's like, all right, let's go. That's not how it works.
Well, whether you're a bride or in the wedding party or just going to a wedding, having great looking skin is probably the best thing you can do. So rather than covering problems on your skin with makeup, which a lot of people do, and then the makeup makes it worse, you can actually improve the health of your skin. And you should have a plan, like a 6-month plan to improve your skin, starting with evaluating it with a professional and getting an individualized plan to improve the quality of the skin. And that's one of the best things you can do for a wedding because it's the first thing that people notice. And you're doing it for yourself because healthy skin is enjoyed by everyone.
Sure, so it's like that dewy glow that everybody wants, right?
Exactly.
Okay, sounds good. So you mentioned 6 months here. Is that something then you meet with somebody in your office and then not everybody's plan's the same, right? It's going to depend?
No, it needs to be individualized because different people have different skin issues. And some will need a longer time, whether it's acne or pigmentation or aging lines or just older appearing skin. You want to start with an evaluation and then get a plan that's specific to your skin type and your lifestyle and your budget. And then you can start working on it. And generally it takes a few months to really do that. And you can transform your skin with the right program. The problem is people go out and they buy a lot of marketing gimmicks and they binge shop for things they don't know what it does. And a lot of phony claims are made. So it's important to get someone you can trust and get a professional evaluation and get a real plan.
Sure, you can probably spend a lot of money on all the creams, right?
Oh, yes.
That may or may not do anything.
And people do, right.
That's what I do. All right, well, we have another question from what exactly is a mommy makeover and why is it so popular?
Well, mommy makeover is kind of just a general term for trying to get your body back after pregnancies. And it's extremely popular, and it may involve anywhere from the breast, where you lose volume in the breast or want to lift the breast from sagging, reduce abdominal extra skin with a tummy tuck or liposuction, elevate the buttocks or improve buttock contour, or even vaginal rejuvenation. So it involves many areas depending on where the woman's body was affected. And it is something that people spend a great deal of time looking at, so we can do a plan for that.
Okay, sounds good. And hey, you could always do the daddy makeover too, right?
Yes,
of course. Yep.
You know, we talk about that. Apparently the dad bod is acceptable, but the mom bod is not. And I have a real problem with that, okay?
Okay, all right.
It's not your fault, Dr. Barone, I promise.
What is a dad bod, though? Is it just the beard, the pooch?
I don't.
You got, no? All right, I want you to explain now.
Okay. Yeah.
All right. Dr. Frank Barone, thank you so much for joining us.
Yeah.
Appreciate it as always.
Happy
You make
New
it
Year.
a little bit more interesting. You stir it up. I like it. You stir up the pot. All right.